In this extraordinary heat to be here for an incredibly exciting announcement. I am so proud, as president of NARAL Pro-Choice New York, to say with such enthusiasm and such pride that we are endorsing Chris Quinn to be the next mayor of New York. Let's be clear, for 20 more years, I would say, Chris, in both her personal life and in her professional career as a public servant, has been an outspoken champion, a true leader when it comes to the rights and health care that women need and families need all across this city and frankly across this country. Her record of commitment is not only unparalleled, I would argue, it's actually even unprecedented. New York City could have no greater advocate for women's health and reproductive rights than Chris Quinn. She has been a true leader. She has worked in so many capacities to address literally every barrier that we find when it comes to women being able to access the health services that make a woman's right to choose a reality. She not only holds the line, she moves us forward. I want to give you a few examples. I won't go through all of them because I don't know that we all have that much time. For example, when Operation Rescue decades ago targeted providers in upstate New York, Chris Quinn, who was still then a council staffer, organized volunteers to travel to Buffalo to stand in solidarity with healthcare providers and with the pro-choice community there. When public health experts started to raise the red flag about the dearth, a very disturbing dearth, and we continue that today unfortunately, of those OBGYNs who are actually capable of providing the full range of reproductive health services that women need, Chris Quinn was instrumental in making sure that the public hospitals in New York City, who train so many of this nation's doctors, teach about abortion care and management of miscarriage, which so many people forget actually involve the very same medical training and techniques. When our city was looking for new approaches to address unintended pregnancy, Chris sponsored not one, not two, but 3 bills to expand access to emergency contraception, to make sure that women have a second chance to prevent pregnancy, ensuring that that backup birth control method is available in our health clinics, that rape survivors have access to it in our ERs, and that it's easily found in our local pharmacies. When she heard that healthcare workers are being besieged at women's health clinics by anti-choice extremists, she led the way for the New York City Council to pass legislation to protect women and healthcare workers from harassment, intimidation, and the threat of violence. And just last year, she yet again renewed that commitment by creating the New York City Council Clinic Protection Project to train volunteers who will escort women safely into women's health clinics for the care they need. At a time when New York City, see I told you there are a lot, at a time when New York City's young people are continuing to experience higher rates of unintended pregnancy, sexually transmitted infections, and other negative reproductive health outcomes that affect not only their health but their futures, Chris pushed the city to adopt and has made a strong commitment to fully implementing a comprehensive medically accurate approach to sexuality education and making sure that young people have access to the services that they need. Each and every time our representatives in Albany waver, anytime an anti-choice politician in Congress decides to impose their extreme ideology on the women and families of this state and this city, she has stood up, she has stood tall, she has used her power, her passion, and demonstrated her compassion to do the right thing, she says to these officials, just as she has and she will. Her commitment to these issues is absolutely unprecedented. Her record of leadership is unparalleled. And her vision for the future of New York when it comes to women and families is truly unmatched. Here's one of the other reasons we have to do this, and we have to do this today. Attacks on women's health and reproductive rights are coming fast and furious all across this country, virtually from every angle imaginable. We've seen Congress wage an all-out assault on choice for the last 3 years. The Supreme Court just agreed to hear 2 abortion-related cases that could directly implicate Roe v. Wade. And we've seen from North Carolina to North Dakota to Texas to Wisconsin, the list goes on and on, unfortunately. Politicians are working double time, triple time, through the night, special sessions, every procedural shenanigan you can think of to try to eliminate a woman's right to choose and prevent access to the reproductive health care that women need, with no regard to true safety for women, no understanding of the real lives that are at stake here, and no appreciation or respect for the values of their constituents. So it has never been more critical a time to have elected officials who are willing to go above and beyond to safeguard the right to choose and support access to reproductive health care. Chris truly stands out, not only in the field of candidates to be the next New York City mayor, but in the field of candidates for political office all across this country. We, as New Yorkers, have an extraordinarily unique opportunity to show the nation, to lead by example. This is what it means to have a real pro-choice champion at the helm of this city. Chris is exactly the leader that this city, this state, and this nation needs today and needs tomorrow. Couldn't be prouder to stand here. Thank you.
Andrew, thank you very, very much. I want to thank the whole NARAL board. I know Kim Charles and Sarah Kovner are here. Thank you both. I want to thank all of the NARAL staff and volunteers who are part of the great work that you all do here. As Andrea said, fighting for the health care of women and girls and family, it's been part of my life's work. And every time we've needed New Yorkers to stand up to make sure that we're not just on the defensive for women and girls and their families, but on the offensive. I've been so proud and honored to have that opportunity to stand with NARAL Pro-Choice New York. And I've never seen the limits of the 5 boroughs as limits in what I had an obligation to do. Whether it was riding a bus through the middle of the night to get to Buffalo, to stand to make sure the women of Buffalo were going to have the right to get into clinics, or organizing clinic defenders here in New York City during the 1992 Democratic National Convention, the so-called Operation Rescue, wasn't going to shut down our clinics. Or finding ways through legislation as Health Committee Chair to expand access to emergency contraception and to bring advocates and women and hospitals and healthcare providers to find a way to make sure that every time a rape survivor goes to an emergency room, she is offered emergency contraception. Or to make sure we had the money in the budget so the interns and residents trained at the Health and Hospitals Corporation would know how to do abortions and other procedures. We're lucky to have a lot of pro-choice elected officials in New York, and lucky to have a lot of pro-choice elected officials running for mayor. But being pro-choice isn't about just taking a position. It's recognizing that you have to be fighting every day, not just to be on the defensive, but to be on the offensive for women and girls and families. And it also means you have to see the connection between issues like infant and maternal mortality still being too high in lower income communities in New York City, and the connection between that and the accessibility of emergency contraception, our need to teach sex education more aggressively and comprehensively in schools. You know, we've seen Mayor Bloomberg, to his credit, take on national issues that are beyond the scope of the legislative power of a mayor. We've seen that in guns, we've seen that in immigration. I want to be the mayor that takes the health care needs of women, girls, and families, the reproductive health care needs of women, girls, and families, and makes that a national crusade and a crusade in Albany. If we're going to live up to the promise that New York City is for women and girls, then we have to not only make sure that every family in every neighborhood in the 5 boroughs has access to the complete health care that they believe is right for themselves and their family, but we have to make sure that every American woman, every American girl, every American family has that same right and option where they live. So I'm so proud of this endorsement. I'm so proud to get to stand with all of you here today, but even more than proud, I'm excited, because come January 1st, we're going to take the success we've had in these 5 boroughs and take it further, all throughout the city, because I'm gratified, but I'm not satisfied with where we are as a city. But better than that, We're gonna take it to Albany, and we're gonna win in Albany, and we're gonna take it across the country to help other women and girls and families define their own families, their own lives, their own destinies, and help those women, girls, and families be healthy and well and have full health care everywhere they live. So thank you all so much, and I look forward to that work in this city, in this state, and in this country moving forward.
Thank you.